It's the essential equipment that makes their job possible and helps protect the most vulnerable. But from tomorrow, Scottish Government funding for COVID costs like PPE will be axed for adult social care providers, leaving facilities like this one in Kirkcaldy to foot the bill.
So this is our PPE store for our care homes. We have 8 care homes in Fife, and what we have here is contingency for about a couple of weeks.
Alison has been stockpiling, but the changes could put smaller homes out of business.
Because our costs have skyrocketed over the last 3 years in comparison to where they were before. So that additional funding was really vital to helping us contain and maintain a sustainable business. We're still going through the same amount of PPE. I mean, obviously we're still having to include everyday wearing face masks in care homes is still something we have to wear. So there definitely needs to be a change in the way that we're funded in order to support the increased costs.
It comes as COVID cases continue to rise in the community. Last week, almost 900 care home staff and residents across Scotland had COVID. It's the worst possible time, industry leaders say, to cut the funding.
Of all the steps taken, I think this is regressive, unhelpful and positively dangerous. The way in which care homes are paid to support somebody is based on the use of PPE before the pandemic, when it was probably around about less than £1 per resident per week. It's now on average between £20 and £30 per resident per week in many care homes. So that's a huge difference to make up.
The Scottish Government says this funding was always time limited, and other costs like testing and vaccinations will continue to be covered. For some, though, it's a worrying development in a sector still getting back on its feet after COVID. Laura Alderman, STV News.